Nurse Kim, and I want to introduce you to my patient. This is Mrs. Smith. She's a 78-year-old widow, recently admitted to the unit with a fractured pelvis. Her wound has healed and it's been 3 weeks since her surgery. She's on complex care with a past medical history that includes hypertension, GERD, atrial fib, and she's got a slight COPD as she was a smoker for most pelvis. Mrs. Smith is allergic to penicillin. So I've been assigned to care for her today, and I will have to do an assessment on her and then give her her morning medications. So I'm going to get started with that. So first I'm going to go and see my patient and check her vital signs. Hi, Mrs. Smith. My name is Kim. I'm going to be your nurse today. How are you feeling?
Okay, nurse.
Are you having any pain?
Just a little achy.
A little achy, okay. And can you tell me what your pain is out of 10?
Maybe 3 or 4.
A 3 or 4, okay. And where is your pain located?
It's arthritis in my knees.
Oh dear, arthritis in your knees. Okay, but your hips aren't sore?
Not as bad.
Okay, all right. Well, I'm going to go ahead and get your vital signs. I will sanitize my hands.
Can I have some Tylenol when you come back?
Oh, I'm in such a rush, but I will try and get to it as soon as I can, okay?
Thank you.
Okay, so first thing I want to do is do your blood pressure. Oh dear, your blood pressure's a little bit low. It's 90/50. And then, of course, I need to do your radial pulse. So let me just find your pulse. I'm going to count it for 15 seconds. And your radial pulse is 49. That is also a little bit low. However, I have some medication that's going to help that. So I'll be back with your medications. Are you okay?
I am, thank you.
Okay, let's get started with these meds because I'm really in a hurry. I don't have a lot of time. Okay, so we have our doctor's orders right here, and she can have acetaminophen for that pain. She's got morphine 10 milligrams, amoxicillin, a nitro patch daily and off at night. She gets lactulose for constipation, Ventolin, 2 puffs PRN. She has low pressure for that she has to have held if her systolic's less than 100, and digoxin 0.125 milligrams. So I need to get started because I've got a lot to get done today and I don't have a lot of time. So she was having some pain, so I'm going to go ahead and try and find some Tylenol for her. Let me just find our acetaminophen. Acetaminophen. Do we have acetaminophen? Oh, here. Oh, that's okay. Oh, we have a rectal suppository of acetaminophen. Oh, okay. Here it is right here. Let me see. Here's her acetaminophen. Okay, so those are 2 tablets. They're 325 milligrams each. She gets 650 milligrams, so I've got that. I need low pressure for her, 50 milligrams. Low pressure, 50 milligrams. Okay, 50 milligrams. I'm going to give her one of these. And, okay, let me just sign these off because I'm going ahead and giving them. So I'm just going to sign them right now. Nitrodur. So here's our patch. So she gets Nitrodur 0.4, perfect. Ventolin 100 micrograms. So we've got a Ventolin in here somewhere. Oh, that's PRN though, but I don't think she asked for a Ventolin. I'm not going to give that to her. Digoxin, 0.125 milligrams of digoxin. So let's just look for that. Oh, here it is. Okay, so let's just see. This is 0.25, and she's to get 0. Oh, I'm going to have to do a little bit of math here. Just 1 minute. Oh, dear.
Excuse me, Kim.
Yes.
Your admit is up from ER.
Oh my goodness.
They want you in the room. Can you
Listen,
get there?
I don't have time to do a mitt right now. This is kind of crazy. You know, I'm really busy. So, hey, what did you do this weekend? Did you go to that ski trip?
Yeah.
Did you have fun?
It was
Oh
awesome.
my gosh, I really wanted to go.
We had so much fun.
I know. Okay, all right. Yeah, did you go out to eat or what did you? It was really
It was a
funny.
great
Oh.
time.
Okay, all right. Well, listen.
So can you get to that room because everybody else is busy?
Okay, tell them I'll be 5 minutes.
Okay.
Okay, all right. I need to hurry up and get this done. Okay, so
I
let
can
me
get
just.
the IV pole and everything there for you.
That would be perfect. What was I? Oh yes, that's right. My math. Okay, so let's just see. We're gonna do some math real quick. So this is 0.25 milligrams of digoxin. So 0.25 milligrams, and I need to give 0.1250 milligrams times 1 tablet equals, okay, I've got to give 2 tablets then. Okay, so I'm going to just get 2 tablets of my digoxin. And I'm going to sign that off because I'm going to give it. And that we didn't need. We have that. Morphine, 10 milligrams. Oh, there's no route. Oh, I know that guy. He likes it to be given sub-Q. I'm going to give the morphine sub-Q. That's how he'd want it. Let me just try and find it here. Morphine. These cards are so hard to find everything in. Oh, here's morphine right here. Okay. And it's 10 milligrams of morphine. Oh dear, this is 2 milligrams. I'm gonna have to give 5 of them. Okay, 1, 2, 3. Okay, I've got 5 morphines that I'm gonna give. And I'm gonna give that sub-Q because I know that doctor and I know that that's how he wants it given. So I'll draw those up. And I'm gonna sign that as well. And let me just put these in there. And last but not least is amoxicillin, 250 milligrams. Oh, here's amoxicillin, 250 milligrams. So I think it's, okay, you know what? I'm gonna give her 2 pills because the bottle says that it is 125 milligrams each. So I'm gonna go ahead and give that. Okay, so I've got this and this. I have to sign off my amoxicillin before I go and give it. Okay, so I've got everything I need. I'm gonna need I have to give an injection for my morphine, so I just need to find some. Oh, that would be great to use an insulin syringe. Oh, look at this, will be perfect. Okay, so I might have to draw them up, each one. Okay, so let me just bring all these to the bedside then. Hi, Mrs. Smith. Remember, I'm Kim.
Yes, you introduced yourself. Hi, Kim.
I'm bringing you your Tylenol, and you can have morphine as well, so I'm going to give you both. I have all your pills right here.
Okay.
I'm gonna sit you up a little bit, okay? Can you take your pills laying down?
Yes.
Oh, well, heck, that's great. Okay, so I have all your pills for you, and I'm gonna just pour these last 2.
If you could leave me the Tylenol, I can take it later.
Oh, okay, I can do that. All right, well, I tell you what.
Leave it there and I'll take it when I get up.
Okay, I'll leave it and we'll take everything else, okay?
Sure.
So I'm just going to have you take these pills.
Oh, I don't usually take a blue pill.
Oh, you know what? I think the doctor changed it. I think he decided to use one of those generic pills, so it's fine. I'm sure it'll be okay. You don't mind, right?
No,
I
if you think so. And there's an extra pill in my cup.
Oh, there's an extra pill. Well, I think he upped your dose for your blood pressure. I'm pretty sure that's what happened. So,
Okay.
so we'll take all of these except for the 2 Tylenol, which I'm going to leave at your bedside. And then I hope you don't mind, but the morphine is in 2 milligrams, and so I'm going to have to draw up and do a couple of different injections, okay?
Oh, that's okay.
Okay, good. All right, so let me just draw this up. Okay. You know, I didn't bring any alcohol swabs. But there's our morphine right there, but it's 2 milligrams and I need to give 10. So I'm gonna have to do 5 of these. And I'll just keep drawing all this up. So I can only give 3 mils in one site. So actually I can draw up one more. Okay, that gives me 3 mils. And I'm going to go ahead and just give it to you right in your hip. So I need you on your side. And then I can landmark, oh, this is kind of difficult. Well, I'm just gonna guess that it's gonna go right there.
Oh, perfect.
Okay. I just have to give the other 2. I'm just gonna use the same needle and syringe and I'm gonna give the other 2. So that's the other 2 mils. So that now gives you 10 mils.
What is morphine, Kim?
Oh, morphine's for pains. It's going to take away the pain that you're having in your knees.
Oh, thank God.
Okay. So that's it for your pills. I'm going to leave your Tylenol at your bedside. Like you asked, you can take it whenever you want. I'll go ahead and chart that you're just going to take that later.
Could I have a little water?
Oh, I forgot to put your patch on. Yeah, let me get you a little bit of water while I'm gonna put your patch on. Okay, here's some water. There you go, that's better. And we're just gonna put this patch right here. There we go. Okay, are you okay?
Yes, I am. Thank you.
Okay, great. I will see you later. I have to go get that new admission.
Okay.
Bye-bye.
Bye, thank you. If you can either email me if materials for quiz 1 or 2 will come from any of the recent pre and post tests.